It's the 2nd of November 2013 and this is my 7 months and 4 days update on testosterone. On the 30th of October I turned 25, which is a milestone in itself, but it means a lot more to me because I always said to myself that by the time I was 25 I wanted to be on hormones, and to be 7 months the day before my 25th birthday is an achievement in itself. So changes at 7 months, I don't know if it's because they're either slowing down or I'm not noticing changes as much as I was in like month 3, month 4, month 5. The only two main things that I've noticed so far at 7 months is voice. Every so often I'll go through a little phase of thinking, right, my voice is starting to level now, it's not going to change anymore. And then I get this it's like a dry cough where I want to get something out of my throat and I can't. And that usually signals that there's another drop going to happen, which I experienced last night. So I think it is still steadily now getting deeper. My hair, I've noticed, has, not the texture hasn't changed, but it's getting greasier more quickly even, and it's starting to recede a little bit more and it's falling out a little bit, which is worrying, but I think that's because of the length it is. So those are the main changes for 7 months, but October's been a busy month for me. I went back to Leeds for the hormone clinic, saw the hormone doctor, Dr. Ayres, and she's lovely, so easy to talk to, and we talked hormones, as you do at a hormone clinic. But I'm going to explain a little bit the hormones that I'm on now and the hormones that Leeds have prescribed for me. So, for the past 7 months, I have been on Testogel. Testogel is 50 milligrams of gel of testosterone. So that's what you get. You get 30 of those in a box. You apply those every day. I apply them to the tops of my arms and to my stomach, and that's what I've been prescribed by Dr. Curtis in London. So that's what I've been on. So when I went to Leeds, I went with my blood results, as you do, and my testosterone levels are 29.4, which is quite high. For the NHS, that's quite high. They like you to be between 24 and 26, which is what a biological male's testosterone should be, so mine's on the higher side. So they want me to bring that down a little bit. So what we've decided to do is, I only have this box left of Testogel. I'm applying Testogel now every other day to try and get my T levels a bit lower. The reason I like Testogel, and I've said this before in quite a few videos, is that because you apply it every day, it keeps your testosterone levels constant. So there's no peaks, there's no troughs, because you're applying it every day. It keeps everything at a nice steady level. So we discussed which types of other testosterone I can take, because I want to go on to injections, because the only criticism I have with Testogel is, because you apply it to your skin and it's absorbed by your skin, once you've applied it, one, you have to be careful with contact with other people, especially if you've got a girlfriend or a boyfriend, which I don't at the moment, which is okay, because you can transfer it onto other people. You can't shower 6 to 8 hours after you've applied it, so when I'm working out, I really have to plan when I'm going to shower. If I go to someone else's house, I have to apply it, I have to find a time to apply it, and so that can get very annoying. So I've decided I want to start injections. So Dr. Ayres said that I can either be started on Testosterone, which is an injection every 2 weeks, or Libido, which is an injection every 12 weeks, so every 3 months. I decided to go with an libido because of the time frame, so you have an injection once every 12 weeks. So I was prescribed libido. So that's 1,000 milligrams in a 4 ml solution of testosterone. So it comes in a little vial. Actually. So that's it. So that gets injected every 12 weeks. It's slow releasing, so it should theoretically keep your testosterone levels at a more constant level than the sustanon, which is every 2 weeks. So you get injected with sustanon and you peak and then you come down over those 2 weeks and then you peak over this one. So it's 12 weeks, so you get 1,000 milligrams of testosterone pumped into your system, slow releasing, shouldn't have so much of a trough. I'd be very interested when I try it, when I start this, because I haven't started this yet. I still got to finish the Testogel first. But I'd be interested to know how much of a difference the injection will make rather than the gel. That'll be interesting. So that's what happened at Leeds. What also happened at Leeds, after my hormone appointment, I saw Hayley again, who's my care path worker, and we spoke about surgery again. There's been a change in how the NHS time surgery for transgendered patients or people. So before, so basically, the NHS has a reform. Before the reform, to be eligible for top surgery, you had to have been living in full-time role with evidence for a year. You had to have been on hormones for a year. Monitored hormones by a doctor, not self-prescribed. That's for top surgery. For hysterectomy, you had to have lived in full role for 2 years with evidence, and you had to have been on hormones for a year. I think that's right. Now that the NHS has reformed, those timings have changed. So now for top surgery, you have to have been living in full role with evidence for a year and only have been on hormones for 6 months, which I am eligible for now. For hysterectomy, you had to have been in full role with evidence for 2 years, and again, I think this is right, hormones for 6 months. Pretty sure. It's the full-time role that's the most important thing with evidence. You have to be able to backdate it, which I can to 2012, which means my 2 years as of 2014 means I'm eligible. So, I'm eligible for both. This is only for first opinions, this isn't for actual surgery dates, this is for first opinions. I am eligible from January 2014 for both, for hysterectomy and for top surgery. Which means I'm getting an opinion, I think it's on the 14th of January, I'm not sure, I have to ring them and ask them if that's correct. But on the 14th of January 2014, I'm going to see a doctor at Leeds, at the Seacroft Hospital, the gender clinic, for a first opinion on hysterectomy and mastectomy. Which is scary because I didn't realise it was going to be that quick, considering we're just now, 2nd of November, so that's 3 months away. That's scary. Something I definitely want, but I didn't think it was going to be happening this quickly. So yeah, that's a bit scary. So that's my 7 months. So a lot's happened. I've moved. This is my new flat. Yay! So that happened again in October. So October's been a really, really busy month for me. So yeah, that's happening. So I think I covered everything that I wanted to cover. Yeah. So next time will be my 8 months. So, and I'll be on libido. So we'll find out if there's any changes that have happened. So I will all see you in a month's time.